we've reviewed the objectives for today, and I'm just going to go ahead and get started with some general information in terms of medication adherence. And let's start with a definition. I think the best definition and probably the most basic is really adherence, as we're going to talk about it today, is the extent to which a person's behavior, such as taking their medication, corresponds or agrees with the recommendations from their healthcare provider. So are we in line with what we've told the patients, and are the patients in line with what we've asked them to do? So when we look at medication adherence, there's some startling statistics, in my opinion, and here's some data to support that. First of all, almost a third of patients never even get their prescription filled. So they leave the office from their practitioner with a prescription, or the prescription is called in to the pharmacy for the patient, and it's either never picked up or just never filled. Also, medication is often not taken as prescribed in about half of the cases. Probably the most common example there would be patients who only refill their 30-day prescription every 60 days. We know something's going on if they have 30 pills, they're supposed to take it once a day, and they're only getting it filled every other month. So it's something that we would need to address from a practitioner standpoint. We also know that medication adherence drops off after the first 6 months. So patients may start taking their medication as prescribed, and then after about the first 6 months, either they're not seeing a benefit or something else is coming up and they're not continuing their medication. There's also additional data there that you can see on the screen with some references, but as the last bullet shows, this adherence issue is only going to increase with the chronic conditions that we have. And within the next 5 years, patients who are affected by at least one chronic condition requiring them to be on medication will grow to approximately 157 million. So let's look at different disease states or different reasons why patients are put on medication and what their adherence might be. Some of us might think when patients are diagnosed with cancer that would really increase their adherence. You know, with such a life-threatening disorder, patients would certainly take their medications as prescribed. But as we can see here, the percentages is really not even to the 2/3 point that patients with cancer take their medications as prescribed. Some economic considerations. Certainly there are direct costs to patients not adhering to their medication. It's estimated somewhere between 100 billion and 289 billion annually. The costs are about $2,000 per patient, and that's based on physician visits. And one of the encouraging statistics is that if we are able to improve self-management of chronic diseases, we can actually see a savings, a cost savings from a 1 to 10% increase there when we're able to increase patient self-management. So let's look at some of the interacting dimensions of non-adherence. If there was just one factor that patients weren't adhering to medications, you know, we could probably address that pretty adequately. But there are so many factors that go into non-adherence. The first one being the healthcare system or the healthcare professionals. It could be not communicating with patients adequately, not educating patients appropriately. So that is one factor. Looking at some of the patient-related factors, it could be anything from patient doesn't understand why they need to take the medication, they don't understand how they're supposed to take the medication. The next one is therapy-related factors. They may not understand their disease state enough to realize why that medication is important. Some condition-related factors, perhaps patients who are on chemotherapy might be dealing with nausea and vomiting, and they aren't able to hold down their oral medications. And then finally, we have the social and economic factors that come into play. Patients not being able to afford their medication, perhaps no one can pick up the medication for them. So as you can see, with all of these various dimensions, it makes it difficult for us to achieve high rates of adherence. Screen's not advancing. There we go. So let's transition over to oral oncology therapy and look at some of the reasons why the preference, first of all, is so high for oral therapies over IV therapies. when we look at the oncology population, and it really is shifting in terms of how many patients are on oral therapies versus IV therapies. And then, of course, we also have a number of patients who are on both, who have oral therapies as well as IV therapies that they're taking. Certainly, the preference for oral, when patients are surveyed, they prefer oral over IV. Not as many visits required, the time involved, no IV access that has to be required, less disruptions into their daily life, and greater flexibility and convenience. But some of the barriers to oral adherence, and this says oral chemotherapies, but many of our oral therapies in oncology are targeted agents and not chemotherapy. So what I'm talking about here really includes both. But there is certainly a greater complexity. But we've got to educate patients that this isn't just another pill that doesn't have side effects associated with it. It's not like taking a Tylenol or an ibuprofen. We've got to really help patients understand the side effects associated with their therapies and how to manage those and when to call us or call their oncology office when they're having problems.